Are you interested in natural health and healing and alternative remedies to common illnesses and disease? Are you tired of taking toxic pharmaceuticals that only make you feel worse? Are you fascinated by the complexity of the human body and want to learn more about how the body works? Are you buried under tons of health books and articles that you just don't have time to read? Well, if you answered yes to any of the above, then fasten your seatbelts and buckle up. This show will take you exactly where you want to go. Welcome to Nothing But Health. Dangerous road, and I decided to take my health into my own hands and turn that buggy around. So, in each of these episodes, I'm going to do a lot of reading. Reading to you from what's out there in the field of health and natural alternative medicine, written by those who are experts and who know of what they say. I would first, I'm going to cover the side effects of two very popular and widely prescribed drugs, Avandia and Prilosec, and those two classes. Now, Avandia, it's a drug for diabetes, type 2, and Prilosec, it's a proton pump inhibitor prescribed for GERD, or acid reflux. Now, both of these are easily treated naturally, but first I'm going to go over the side effects and the warnings associated with each of these drugs. The information will come from drugs.com, directly from their website. And then I will give you some natural remedies from the experts. Not from me, but from the experts, people who know what they're talking about. Alright, so let's start with Avandia. Avandia, and I'm reading, is an oral diabetes medicine that helps control blood sugar levels. Avandia is for people with type 2 diabetes. It is sometimes used in combination with other medicines, but is not for treating type 1 diabetes. Other similar type 2 diabetes medications include Amaryl, Glucophage, Januvia, Levemir, Lantus, and others. I did not copy the whole list, but there are many of them. Taking Avandia may increase your risk of serious heart problems such as heart attack or stroke. Nice. Therefore, Avandia is available only to certain people with type 2 diabetes that cannot be controlled with other diabetes medications. Only medications, nothing natural. Avandia is available only under a special program called blah blah. I'll skip that. Do not use Avandia if you have type 1 diabetes or if you are in a state of diabetic ketoacidosis. That means that you're not able to use the glucose in your body, so you're using amino acids, and that's producing ketones, and you're becoming more acidic as a result. That's never good. Before taking Avandia, tell your doctor if you have congestive heart failure or heart disease, a history of heart attack or stroke, liver disease, or eye problems caused by diabetes. Before taking Avandia, do not use Avandia if you have type 1 diabetes or if you are I already said that. To make sure you can safely take Avandia, tell your doctor if you have any of these conditions: congestive heart failure, heart disease, heart attack or stroke, liver disease, eye problems caused by diabetes. Women may be more likely than men to have bone fractures in the upper arm, hand, or foot while taking Avandia. Interesting. Talk with your doctor if you're concerned about this possibility. Well, yeah, that's a bit concerning, I would say. FDA pregnancy category C, it is not known whether Avandia will harm an unborn baby. Tell your doctor if you're pregnant or plan to become pregnant while using this medication. Some women using Avandia have started having menstrual periods, even after not having a period for a long time due to a medical condition. You may be able to get pregnant if your periods restart. Talk with your doctor about the need for birth control. Side effects of Avandia for the consumer. All medicines may cause side effects, but many people have no or minor side effects. Check with your doctor if any of these most common side effects persist or become bothersome when using Avandia. Cold-like symptoms or headache. And then, below, it says seek medical attention right away if any of these severe side effects occur when using Avandia. So obviously these are effects that could take place, that could occur upon using Avandia, although they're rare. They include severe allergic reactions, rash, hives, itching, difficulty breathing, tightness in the chest, swelling of the mouth, face, lips, or tongue. That's nice. Unusual hoarseness. Blurred vision or other vision changes. Chest, jaw, or arm pain or discomfort. Fainting, lightheadedness. Numbness of an arm or leg. Red, swollen, blistered, or peeling skin. Severe headaches. Stomach pain, vomiting. Symptoms of heart failure. Shortness of breath, sudden unexplained weight gain, swelling of the hands, ankles, legs, or feet. Symptoms of liver problems. Dark urine, yellowing of the skin or eyes, unexplained nausea, vomiting, or loss of appetite, stomach pain. Symptoms of low blood sugar. For example, anxiety, increased sweating, dizziness or drowsiness, headaches, chills, tremors, increased hunger, unusual bone pain, especially in the hand, foot, or upper arm, unusual tiredness or weakness. This is not a complete list of all side effects that may occur. If you have questions about side effects, contact your healthcare provider. So there you have it. You have blood sugar problems, so you are given this drug, and you could end up with a heart attack. So, what are some natural remedies, proven, that could clear up your diabetes problem in days or weeks? Let's see. First, let's see what Dr. Wallach has to say. I'm going to be reading from Dr. Joel Wallach and Dr. Malan's book, Dead Doctors Don't Lie. Nice title. Catchy. I'm going to start from page 320. It says, treatment of diabetes should include chromium and vanadium at 250 micrograms per day in the initial stages to prevent insulin shock. Keep checking your urine blood sugar before and after meals, and as the blood sugar level drops, you can adjust your insulin or pill medication just as you have been taught. You also need to deal with food allergies that can cause celiac-type intestinal lesions, the most common being wheat gluten, cow's milk, soy, etc. And supplement with betaine, hydrochloric acid, and digestive enzymes. Treatment of diabetes should also include zinc at 50 milligrams 3 times daily, B-complex at 50 milligrams 3 times daily. Be sure to include niacin, which is B3, which is part of the glucose tolerance factor. Essential fatty acids at 5 grams 3 times daily. Vitamin B12 at 1,000 micrograms per day. Now, most supplements out there give you 50 micrograms. You need more. You need a lot more. Up it. 1,000. He also recommends bioflavonoids, including quercetin, which comes from onions. Copper at 2 to 3 milligrams per day, which is needed to it's a cofactor needed to go with zinc. Lecithin at 2,500 milligrams 3 times daily. And glutathione, which is a detoxifier for your liver at 100 milligrams per day. High fiber, high complex carbs. These are recommended. No natural or processed sugar or carbohydrates. Why? Because you have a blood sugar problem. So, you need to cut out the sugar. You need to cut out the simple carbs, the things like potato and rice, white rice, and bread, and bagels, and muffins, and pancakes, and all these things that turn directly into sugar when they enter your bloodstream. Oh, I lost my place. Eat meat, eggs, and poultry 3 to 6 times per day in the beginning. Every time you eat processed carbs, sugar, honey, alcohol, mashed potatoes, etc., you lose 300% more chromium in your urine than when you consume complex carbs. So, if you eat carbohydrates, they should be complex. Sweet potatoes, lots of fiber, brown rice, black rice. Herbs are also useful in treating diabetes. It may include licorice, jabarandi, yarrow, Jerusalem artichoke, and then you also want to supplement with plant-derived colloidal minerals, and the Longevity company has excellent liquid plant-derived colloidal minerals. Just add it to juice and drink it down. Real easy. Okay, so that's what Dr. Wallach says. Now, he recommends simply chromium and vanadium. Truly, if you just added chromium and vanadium, and maybe some digestive enzymes and EFAs, I think you'd be good to go and cut out a lot of the simple carbs in your diet. I did it. It wasn't easy. I don't eat bread now. I don't eat white rice. I don't eat pasta. I don't eat any of that stuff because I know it turns the sugar in my system and it ups your insulin, and I don't need that. So it's not easy, but you can do it. If there's a will, there's a way. Alright, so let's read about chromium. Chromium is not only important for blood sugar. I mean, what doctor tells you about chromium? They don't. Why? Because they probably don't know about it themselves. But here you go. This is why chromium is important. Now I'm going to be reading from a different book. It's the Nutrition Almanac, 6th edition by John D. Kirschman and Nutrition Search, Inc. Chromium is it starts on page 59, and this is the 6th edition. Alright, chromium description. Chromium is now recognized as a major component of glucose tolerance factor, essential for regulating carbohydrate metabolism. It said essential. You have to have it. Niacin, which is vitamin B3, and the amino acids glycine, glutamic acid, and cysteine are the other components of GTF, or glucose tolerance factor. The body requires chromium only in extremely small amounts, found in the blood in concentrations of 20, blah, blah. Chromium as a free metal is not found in nature. So, chromium containing glucose tolerance factor enhances the activity of insulin. Insulin facilitates the storage of glucose in the cells, and GTF improves the uptake of this glucose. One theory is that GTF may bind insulin to its receptors in the cellular membrane. In this way, chromium helps prevent hypoglycemia and diabetes, and secondarily, cardiovascular disease that can develop from diabetes. Chromium may play a role in the metabolism of fats and lower cholesterol levels, while mildly increasing beneficial HDL cholesterol, which is the good cholesterol. The mineral may also be involved in the synthesis of protein through its binding action with RNA molecules. In the blood, it competes with iron in the transport of protein. The most biologically active form is organic trivalent chromium. That's